Ang sakit mapalayo, lalo na sa taong mahal mo. Ilang araw pa lang ngunit parang tagal na. May di akong magandang nararamdaman. Di ko maintindihan kung iba na o pangungulila lamang. Pinaglaban namin ang aming mga prinsipyo. Subalit, nabilanggo ako. Ano kayang kahantungan ko? Pre, nakita ko si Jason kahapon, sumsuka ng dugo eh.
Ah, talaga pre. Grabe naman yan.
Apir,
Jason Capuyan, may bisita ka.
sige po, salamat.
Okay ka lang ba? Nilalagnat ka?
Okay lang ako, kaya ko pa naman.
Kailan pa yung ubo mo?
Hindi ko maalala eh.
Hala, ba't may dugo na yung ubo mo?
Tapos na ang dalaw.
Oh, next. Oh, Jason, namumutla ka ata ah. Balita ko, masama daw pakiramdam mo. Anong meron?
Dok, ilang araw na po akong inuubo at may kasama pang dugo.
Ayon sa history mo, di ba nagka-ulcer ka dati? Baka naulit ng ulit. Tapos, baka napalala lang ng isang viral infection. Ito, bibigyan kita ng gamot para sa ulcer. Inumin mo to ha.
Okay po, Dok.
Hala, may dugo! Nurse, pwede bang makuha yung chart ni Mr. Capuyan?
Okay po, Doc.
Nurse pa-request ng complete blood count tsaka fecalysis. Ayon dito sa chart, meron siyang asawa. Pakitawagan na lang ha. Salamat.
Okay po, Doc.
The number you have dialed.
Magandang umaga po. Ako po si Nurse Christy ng QMMC. Maaari ko po bang makausap ang asawa ni Mr. Jason?
Here is a case of a 40-year-old army prisoner from Samar with a chief complaint of bleeding and hematemesis. Prior to consultation, he was brought to the jail physician and was prescribed with omeprazole. After 2 days, there was no relief of symptoms and was brought to the ER.
Based sa history ng patient, kindly give us your possible differentials.
Since gastrointestinal bleeding siya, we can divide it into upper GI and lower GI. Starting from esophagus, small intestine, large intestine, tapos hanggang anus.
Hemorrhoids o almoranas dahil sa kanyang pagdurugo. Maaari itong makuha dahil sa pag-stay ng stool o kaya naman umiinom siya ng alcohol at nagkaroon siya ng sakit sa atay.
Possible na alcoholic cirrhosis. Since based on the profile, 10 years na din siya nagiinom. This causes portal hypertension, then esophageal varices, kaya nagkakaroon ng hematemesis. Also because there is increased splanchnic blood flow, kaya nagkakaroon ng hemorrhoids, then hematochezia.
We could also consider schistosoma since the patient is from Samar. It is possible that he was infected before he was brought to the prison that lead to the patient's signs and symptoms. We can confirm the infection if fecalysis is positive for schistosoma eggs. So, doctor, kindly look for the result of the fecalysis. Also check if there is presence of occult blood, perform digital rectal exam, check for peptic ulcer disease. You can do urea breath test, or you can diagnose it based from the history of the patient.
Ako po ang asawa. May nangyari po ba sa kanya?
Sinugod siya kanina sa ER. Halika, puntahan natin siya sa kwarto niya at doon natin pag-usapan.
Sige po, salamat.
Doc, ito na po yung resulta ng labs.
Dok, ano po ba yung sakit ko?
Ang sakit na ito ay tinatawag na Schistosomiasis. Ito ay dala ng isang parasite na tinatawag na schistosoma. Nakukuha ito sa tuwing nagtatampisaw ang isang tao sa tubig tabang na pinamamahayan ng tinatawag nilang Oncomelania quadrasi. Loves, saan ko kaya nakuha to?
paparating ng mga kalaban. Magsihanda na kayo!
Napalilibutan na namin kayo.
Bumalik na kayo sa saya ng nanay nyo!
The larval forms of parasitic blood flukes, known as schistosomes, penetrates the skin. The Cecaria loses its tails, becoming a schistosomule, which moves through the various tissues to the veins surrounding the intestines or the bladder, depending on the species, where it will mature to its adult form. Females release eggs, which move from the veins to the lumen of the intestine or the bladder. The eggs are then passed from the body in the feces or urine, and will soon infect its intermediate host on Commelania quadrasi. It will then develop into its infective stage, Cecaria, that can soon infect another individual. Schistosomiasis is still endemic in 12 regions of the Philippines, with 28 provinces, 119 municipalities, and 2,230 barangays. Approximately 12 million people are affected and about 2.5 million are directly exposed. Provinces known to be endemic of the disease include Mindoro Oriental and Sorsogon in southern Luzon, the provinces of North, East, and Western Samar, Leyte and Bohol in eastern Visayas, and all the provinces of Mindanao, with the exception of Misamis Oriental, Davao Oriental, and Maguindanao. Currently, the government through Department of Health address this concern using the following key interventions: morbidity control, mass treatment, infection control, active surveillance, surveillance of school children, transmission control, and advocacy and promotion.
Dahil sa kalaganapan ng schistosomiasis sa lugar ng Samar, kasalukuyang nagsasagawa ang Department of Health ng mass intervention sa pamamagitan ng pagbigay ng praziquantel para solusyonan ang epidemyang ito.
Matapos ang 2 taon, ako ay nakalaya na at ipinagpatuloy namin ang pagtupad ng aming pangarap at ang aming pagmamahalan.
I'm gonna pick up the pieces and build a Lego house. If things go wrong, we can knock it down. My 3 words have 2 meanings, but there's one thing on my mind. It's all for you. And it's dark in a cold December, but I got you to keep me warm. If you're broken, I will mend you, and I keep you sheltered from the storm that's raging on. Now I'm out of touch, I'm out of love. I'll pick you up when you're getting down. And out of all these things I've done, I think I love you better now. I'm out of sight, I'm out of mind. I'll do it all for you in time. And out of all these things I've done, I think I love you better now. I'm gonna paint you by numbers, cold ink. Things go right, the frame.